Welcome to this guide on how to use the Construct Medical Steerable Tracheal Intubation Guide, or STIG as it's known by its acronym. The STIG is designed to resolve the frequently encountered problem of having a clear or partially obstructed view of the larynx and vocal cords when using a video laryngoscope, but an inability to successfully direct an endotracheal tube, malleable bougie or stylet introducer, into position. In particular, the problem of the endotracheal tube or introducer entering the esophagus or hitting the anterior wall of the trachea, rather than successfully navigating between the cords. Before using the STIG, first check the use by date printed on the package. This is the date that is printed beside the egg timer icon. The strike through to icon indicates that the unit is designed for a single patient use. Do not attempt to sterilize or reprocess the device for reuse. You'll also notice that the STIG is constructed of materials that are latex-free. Materials used in the construction of the Steerable Tracheal Intubation Guide include nylon and silicone. Next, check that the packaging has not been damaged or compromised. Damaged or compromised packaging can result in the product being unsterile. If the packaging has been damaged or compromised in any way, do not use the device. Dispose of the device according to your facility's waste disposal protocols and select a new device. Next, open the packet and remove the device from the packaging. You will notice a label attached to the device, reminding you that the device is designed to be used with an endotracheal tube with an internal diameter of 7 mm or above. Please do not attempt to use the device with an endotracheal tube with a smaller internal diameter, as this may damage the device and/or the endotracheal tube. This label also reminds you to use a water-based lubricant on the yellow silicone tip. Remove this label from the device and apply a liberal amount of lubricant as advised. The slider or control mechanism on the underside of the device is used between the thumb and the forefinger to move the tip anteriorly and posteriorly. Try holding the device like a pencil and use your thumb to move the control mechanism back and forth. Observe the tip of the device reflecting the movement of the control mechanism. The slider has blunt teeth to allow grip with disposable gloves. It is positioned on the device so that it will not need to pass through the vocal cords. The blunt silicone tip minimizes the risk of tracheal trauma. The preformed curve is designed to approximate the shape of an adult's airway and can be presented to the vocal cords without the need for manual bending or forming of the device before use. As the device approaches the vocal cords, use the control mechanism to steer the tip of the device between the cords and into the trachea. Do not advance the device more than is necessary, typically between 2 to 3 centimeters beyond the cords at most. Next, slide the endotracheal tube over the device and gently introduce the tube to the airway. It may be useful to turn or corkscrew the endotracheal tube as you advance it over the intubation guide. This procedure is typically known as railroading. It may reduce the need for a fibre optic bronchoscope. The Construct Medical Steerable Tracheal Intubation Guide is protected by various international patents and has been referenced in a number of international peer-reviewed publications. For further information, we invite you to contact one of our authorised distributors.